Despite its prevalence, OCD is one of the most misunderstood health conditions out there. There are several myths and misconceptions about OCD that many people nowadays have unnecessary ideas about OCD that are simply not true. Now, let me tell you some.
Come on, Ewa, it's a little OCD.
How about cleanliness? People with OCD just need to be more relaxed.
OCD is untreatable. People with OCD just need to adapt and live with it.
To clear your mind and thoughts about OCD, let us look further into the definition, symptoms, causes, and treatments of Obsessive Compulsive Disorder, OCD.
Obsessive Compulsive Disorder is defined by the occurrence of both obsessive thoughts and compulsive behavior performed in an attempt to neutralize such thoughts. Now, let us look at the symptoms for people with OCD with Rose.
Thank you, Shah. The symptoms of OCD can be explained by the criteria of OCD in the DSM-5. A person will be diagnosed as OCD if they have the following criteria. First one is the presence of obsessions, compulsions, or both. And the second criteria is all these obsessions and compulsion symptoms, they are consuming or cause clinically significant distress. And third criteria is the obsessive compulsive symptoms. They are not attributable or caused by physiological facts, and they don't have any medical condition like disease or sickness that is already referred by the hospitals. Fourth criteria is the disturbance. They are not better explained by any other mental disorders, whether they do not have any symptoms of generalized anxiety disorders. They are not explained by the symptoms of depression and so on. So that's all from me, and I will pass to my next friend. So Tasha.
Thank you, Rose. Here I will talk about 5 known factors. The first one is genetic factors. You are more likely to develop OCD if a family member has it, possibly because of your genes. The second one is biological or neurological factors. OCD may be a result of changes in your own body's chemical reaction or brain function. The third one is life changes. Sometimes major life changes or important events can trigger an OCD. The fourth one is personal experience. A person who experienced several traumas is likely to be affected with OCD. And the last one is learning. Sit still because nurse will explain about the treatment that can help people with OCD.
Thank you, Tasha. Depending on the severity of the OCD, treatments range from a variety of medications to therapies. In many cases, it has been found that therapies such as cognitive behavioral therapy alone are sufficient. Cognitive behavioral therapy, which is commonly used in treatment, aims to change the way obsessions are perceived and in so doing facilitates change in behavior. Exposure and response prevention, a component of CBT, involves gradually exposing you to a fear object or obsession and having patients learn ways to resist the urge to do their compulsive rituals. In more severe cases, medication is prescribed. Antidepressants are commonly prescribed to help with relieving anxiety.
We need to bear in mind that OCD is a real mental health condition. We hope that this video has created some awareness and opened everyone's minds and thought. Thank you very much from us, and goodbye!